Thank you, Ms. Joseph. To date, St. Lucia has recorded a total of 29 confirmed cases of COVID-19. 19 of those are female and 10 male. 27 of the confirmed cases have recovered and reintegrated into their communities. Currently, there are 2 active cases in care at the respiratory hospital. 19 of the cases have had a travel history from areas with active outbreaks of COVID-19 and tested positive in country while undergoing quarantine. A total of 8,654 tests have been conducted to date. The last confirmed case of COVID-19 was recorded on Saturday, October 10th, and is a 48-year-old minibus driver who presented at one of our respiratory clinics with respiratory symptoms. He was tested as per protocol and was positive for COVID-19. He is presently at the respiratory hospital in care. Investigations and contact tracing has commenced in communities and among key populations of concern as it relates to this case. This process helps in both identifying the source of infection as well as undertaking the necessary assessments and testing to contain the infection. Services at the respiratory clinics were extended over this weekend to ensure an immediate response to support contact tracing related to the case. The Constituency Council office in La Rochus was set up as an outpost for assessment and testing as well. In collaboration with the President of the National Council of Public Transportation, Mr. Godfrey Ferdinand, arrangements have also been made to facilitate the testing of all of the minibus drivers today, Sunday, at the Leclerc Wellness Center, the Viewfort Wellness Center, and the Dengue Hospital from 8 o'clock. This will continue into the week. Testing of all of the contacts commenced on Saturday, October 10th, and continues today and into the week. Immediate interventions in the more affected communities included the distribution of face masks at key locations, the strengthening of preventative and control measures, with the support of the community leaders, social transformation officers, and gatekeepers. The scheduled activities for affected communities are being reviewed to determine their adherence to protocols or the requirement for cancellation of those activities. The present quarantine capacity has been reviewed and the capacity for increased cases as needed at the respiratory hospital. This new confirmed case presents a high level of risk at the community level. The information received to date has not led to the identification of our index case. This is critical and crucial in effectively ensuring that all of the contacts are identified and assessed in a timely manner to facilitate the containment of the disease in country. We anticipate that without this timely intervention, sporadic cases will be identified, leading to progressive waves and full in-country transmission, as seen in many of our neighboring islands. We continue to appeal to the public to cooperate and share relevant information with the health team. We also remind the public that the Ministry of Health remains the official source of accurate information in relation to COVID-19 and to seek clarification at that level. In taking a look at the global picture of the COVID-19 pandemic, over 35 million cases have been recorded with over 1 million deaths, of which the majority were recorded in the region of the Americas, followed by Europe. While we remain at low indices in St. Lucia, the many countries internationally and regionally are presently experiencing a second wave of COVID-19, which has surpassed the previous peaks in the last few weeks. The declines that were seen in the US and Europe, which were noted in July and August, are being reversed as there are increasing numbers of cases being diagnosed in recent weeks. Canada is also showing large increases both in new cases and deaths. This second wave poses particular concern as it is occurring at a time which annually is the flu season, where respiratory illnesses tend to be on the increase. On a regional level, the Caribbean islands have recorded a total of 237,302 confirmed cases, with 4,045 deaths. Many Caribbean islands are also experiencing increases They've also experienced increases for us. For example, Jamaica, Bahamas, Trinidad, Cuba, Guyana, Barbados, Martinique, and Guadeloupe. On assessment of the global and regional levels of the second wave of COVID-19, the risk of introduction remains high. We note the following vulnerable areas for us in St. Lucia: the illegal entry of persons from countries of high risk, the second wave of disease in the tourism market, the non-adherence of visitors to the hotel protocols, our returning nationals not adhering to home quarantine, the non-use of face masks, increased mass crowd activities island-wide, the crowding up of public buses without the use of masks, and the non-adherence of many public and private services to established protocols. At this point, we have safely reopened our country. To maintain the gains achieved so far, and given the new risk introduced by this new case, and to maintain public health and safety, it is imperative that each and every one of us play our part to keep our most vulnerable safe. This includes the use of masks in all public places, keeping a safe distance from others, avoiding mass crowd activities and social activities, maintain the infection prevention and control measures, including at home, at work, and avoiding contact with others with respiratory signs and symptoms, as well as seeking immediate care if you develop any of these signs and symptoms. The 5 community respiratory clinics remain open for persons who present signs and symptoms. The 311 information hotline is also available to address COVID-related questions and concerns. We want to remind the public that treatment and care for COVID-19 related conditions remain free of charge to the public. The government of St. Lucia, through the Ministry of Health and Wellness, will continue to monitor the global and regional situation and to strengthen protocols to ensure evidence-based measures are used to guide the recommendations and protocols as we continue to live safely with COVID-19.
Thank you, CMO, for that. And just to let you know, you at home, that as always, if you will be posting your questions on Facebook, I'll be happy to pose those questions to our panelists this evening. We now say hello to Prime Minister Honorable Alan Chastanet with his statement.
Thank you very much. It's for many sad reasons that I'm here tonight. But before I begin, I certainly want to express my condolences to Senator Mauricia Thomas Francis, who sadly lost her son, Kimani Revere, late this week. And I've spoken to her personally, and my heart certainly goes out to her and the loss of her son. I also want to send condolences to the Venturi family. Sadly, a very dear friend of mine, Renato, was senselessly killed yesterday. And I know that his wife, Sherry, is still in hospital, and I'm hoping for her a speedy recovery. On that note, the other burning issue really is the latest case that we've had with COVID. This is a very difficult time because we have 2 battles that we continue to confront in St. Lucia on a regular basis. One clearly is on the health front and our battle against COVID. And to date, very proud of the fact, and all St. Lucians should be proud of the fact, that no one has died. And while we've had cases, we've been very lucky and very successful with our protocols to prevent any kind of widespread cases in St. Lucia. The second battle is really on the economic front. And as I indicated very early in the game, that we have to first deal with COVID and have it under control in our community. And then once we've had that, we then can start proceeding to recover economically. The economic impact is beyond words. In terms of the job losses, the revenue losses to persons of businesses, and clearly the great amount of uncertainty that has been created. But I'm very proud, again, of the plans that we had as a country in slowly reopening our international borders, gaining confidence locally that we can coexist with COVID while we open up our international borders, and the growing confidence that both St. Lucians as well as countries abroad have had in St. Lucia. It's a remarkable feat that England has a bubble, and I think it's about 24 countries or less now that remain on that bubble, meaning that British citizens are allowed to travel to our destination and return to England without having to go into quarantine. Governor Como, who I've had the honor of speaking with and coordinating with to push this protocol, this international protocol of pre-testing on all flights, has also instituted a bubble into the tri-state area, where only 31 countries are within that bubble, and St. Lucia is on that list. So it means that by taking care of business at home, we have put ourselves in a substantially better position. And what's the result of that? We've seen flights resume. In fact, just this week, we've gotten notice from British Airways that they're going to commence from 2 flights a week to 5. We've seen that our occupancy or load factors on our American flights continue to grow from strength to strength. In fact, one of our US partners, airlines, is reporting a load factor of 72% for October. We're now seeing that 80% of our hotel rooms will be open come November 1st. And many of those hotels have started rehiring persons that were employed with them previously. We're seeing that sales locally, restaurants, bars, grocery stores, other small businesses, has been picking up. And that's been reflected in the tax collection that we have as a country. So the fact is that the strategy has worked, and we're slowly seeing some return to some level of normalcy. We are currently in the middle of the IMF and World Bank meetings, and we're battling this idea as to how small island developing states are going to deal with the debt that we're incurring. These are big numbers. So when we say that we've lost almost $400 to $500 million in tax revenue, I know that that's a concept that may be very difficult for a lot of persons to understand. But in essence, we generate around $900 to $1.1 billion a year in tax revenue. That's money that we collect through taxes that assist us in funding government. So when we have a shortfall of $400 to $500 million, it becomes very difficult to make up that gap. And while we've been successful in negotiating soft loans from CDB and the World Bank and the IMF, the Central Bank, and from the Taiwanese government, we're now in the process of making sure we get that money in. And in the interim, the government, which would normally carry payables of about $20 million on a monthly basis, meaning monies that we owe to other persons, that number is upwards of $80 to $90 million. That's money that should be in circulation in our economy. But sadly, it also means that many things that we take for granted, the ordering of medicine, paying of utility bills, paying small bills for suppliers, has become problematic, and it has an impact on those individuals as well as to the public at large. I say all this to say that what has happened on Saturday has the clear threat of affecting what's going on in St. Lucia. I have been at pains many times to remind St. Lucians that we need to appreciate what we have. The ability to go to church on a Sunday, the ability to go to a beach, the ability to go to each other's homes, see our parents, to go and see our parents and not feeling like we're putting them in jeopardy. And unfortunately, it is human nature sometimes to take these things for granted. And I can say to you that in going around St. Lucia, many of us have felt that there is no COVID in St. Lucia. In fact, we've comforted ourselves in those words. And many of us have come to believe that in our heart. But because we're on a small island, and because our neighboring islands, Martinique and other countries, are so close to us, the threat is real. This weekend we saw a 12-year-old boy literally swam from St. Lucia to Martinique, which is an incredible feat in itself, but it tells us how close Martinique is. Unfortunately, human nature is such that while we say that we care for our neighbor, care for our families, our actions don't support that. And the CMO reminded us of what the threats were to St. Lucia. Threats are, if in fact we don't manage the process at the airports well enough with our tourists coming in, and if we don't, or we're not disciplined in how we deal with the tourists at the hotels. The quarantining procedures we've put in place for our nationals returning home. And one of the critical protections that we've put in place is for us to continue to act like we have COVID, which is wearing our face mask, hand sanitizing, social distancing. And we have to do that because the threats are real. But the threat that probably has concerned us the most has been the threat of persons coming into St. Lucia illegally. Because it creates a dilemma. One, we don't know if those persons have COVID, because they wouldn't have bothered to check before they come in illegally. And when they come in illegally, and because it's illegal, everybody wants to keep it as a secret. And it would appear that that's what's happened to us. And because we have to admit as a nation that we have lowered the bar. When we sat with the minibus drivers for months, because the CMO was persisting that they had to remain at 10. And they felt singled out. And the concession was that we would allow it to go back to 15, but with the clear understanding that they as an association would help us to enforce face masks, hand sanitization. Sadly, we've not done a good job, not a good enough job. And I say we, I'm not going to put the blame on the association. We've convinced ourselves that there was no COVID in St. Lucia, falsely. So tonight, I'm here because I'm asking both the Ministry of Health and also the Commissioner of Police that we need to deal with this situation in the absence of any clear evidence that we are going to have a community outbreak. Certainly, when you look at the details of this case, it would be hard to believe otherwise. And so we must start from today assuming that there are many more people who have COVID than the test results actually show. And so to do that, starting now, all of us need to start wearing our mask on a more regular basis. In fact, once we're out in public, we're going to have to do so. I'm asking the police commissioner and the traffic department that they develop a no tolerance policy. Persons will be fined. Persons will be held accountable. Businesses need to double up on their efforts. Many of you have been doing it. I myself have gone many times to restaurants or places and reminded constantly, you have to wear your mask to come in. And I applaud those persons that have continued to do that. And I'm asking you to double up on your efforts. But I'm here tonight to appeal to all St. Lucians that this is serious. What's at stake? It's not only the health of our nation, but is also the economics of our nation. It's no secret. The government has exhausted all of the efforts, all of the resources with the NIC and donor agencies to provide a social stabilization program for the public and for those persons who've lost their jobs. We have no more money. What we're hoping to do is to regain the strength of our economy so many persons can be re-employed. And I want to thank those hoteliers that have come forward and opened up their hotels and start paying salaries despite knowing that they're going to lose money for several months. I want to thank those businesses that in the worst of times maintained the employment and showed the humanitarian side of economics. But the reality is that we have a battle. If in fact there is a community outbreak, we have to do everything in our power to contain it as fast as possible. Because if we don't, and we lose our status and the confidence that the rest of the world has with us, it's going to significantly impact the arrivals that we have into our country. And I've seen other countries who have fallen into a similar trap. And at that point, the only way to continue the economic growth is to lower your standards. And certainly that would be very difficult, if not impossible, for me and my cabinet to agree to that. And so therefore, we have to work doubly hard to make sure that if we do have a community spread, that we can contain it as fast as possible. And I'm speaking to all of you with the greatest level of sincerity, that this is not a joke. When I hear persons saying that we're falsifying information, this is irresponsible. We have always told the truth. CMO, the moment information is received, notifies me, and within 3 minutes, that information is made public. So I'm asking all of us to not listen to this fake news. Don't fall prey to this idea that St. Lucia is some special place in the world and we can have an environment where everybody else around us has COVID and we don't. We earned that status together. And tonight's appeal to all of us is to put us on notice that those liberties that we've had are in jeopardy. That's what's in jeopardy. And unlike what was being promoted, that I was going to announce the shutdown of the country tonight, it's the furthest thing from what we want to do. We don't have the evidence to determine, as yet, the extent of this spread, this community spread. And certainly within the next couple of days, the CMO and her team will be receiving results of the test, and we'll understand how many more people might have possibly been affected. But let us pray that it's very limited and that we've caught this early. But certainly I want to implore upon all persons that anybody has any information as to any persons who are currently in St. Lucia who came in illegally, to please assist the police in identifying them so that we can put them in isolation so that there's no possibility that they can create any further spread. But I'm certainly convinced that it was contact with somebody who came in illegally that has initiated this. And if they've affected one person, which is the bus driver, they can have easily affected other people. And that's what is risk. That's what we expose ourselves to when we do it illegally. And it's too small of a community. So I'm going to ask the commissioner to address you tonight, but in the discussions I've had with him, I'm asking him to please enforce the laws. And I'm looking for the support of the general public. I had an opportunity to have a discussion with the leader of the opposition and also with the district rep from where the bus driver resides. I'm appealing to everyone. Let's work together. Let's meet this crisis head on. Let's accept the fact that the reality is, the realistic reality is that there's going to be a wider spread and that we need to start behaving like that from now. And please work with the police officers. All of us need to become our own police officers, ensuring that everyone is wearing their mask and we're putting those necessary protocols in. Those are there to protect all of us. We've seen globally that when you do these things, it significantly reduces the possibility of COVID spreading. But this is not just about our lives anymore, which is the utmost importance, but it's also about the economic survival of our own country. Thank you.
Thank you so much, Prime Minister. Let's move quickly now to Commissioner of Police, Severin Moncherry. Commissioner, your statements.
Okay, thank you very much. Let me say good night to all. I also want to say a special good night to the executive and all other members of the Royal Central Police Force. I think amidst all of these challenges and restrictions, you've done a fantastic job, and I ask that you continue to do what we've done before. We, the police, will continue to work with the Ministry of Health. And as it stands, we will be enforcing the law fully. We ask for people to assist and to respect and obey the law. Would prefer to have compliance instead of having to use the long arms of the law to discipline the indisciplined. As it stands, we are all in this thing together. And I want to refer members of the public to the COVID-19 Prevention and Control Act. And at section 21(1), it states, in an effort to prevent the spread of COVID-19, a person shall, A, wear a mask or suitable covering over his or her nose and mouth when in public, and 2, at all times, as far as practicable, distance himself or herself at a prescribed space from any other person. There is a penalty if anyone is in breach of this section, and the maximum penalty is $1,000 or 6 months imprisonment or both. I will be speaking to my officers. We'll be meeting tomorrow, God willing, and there will be full enforcement. I ask people, like I said earlier, to cooperate with the police. There should be no fear if you just comply and obey. We need to ensure, Prime Minister said earlier, that you need to adopt the approach that you have COVID. I want to go further and state that you need to also use the approach that everyone around you has the virus, and that you should at all times wear your mask. Whether it be at funerals, sometimes we go to funerals and we realize that people are not wearing the mask. At church, and any social gathering that you're going to have. It will be useful also to read the legislation. And there are also 3 other pieces of legislation that I want to mention now. It is statutory instrument number 151 of 2020, which is the COVID-19 Prevention and Control Physical Distancing Order of 2020. It deals specifically with business places, establishment or offices where customers should at all times practice physical distancing and wearing of the mask. I also want to make reference to statutory instrument number 152 of 2020, and it is the COVID-19 Prevention and Control Wearing of Mask Regulation 2020. It speaks of the persons who are exempted from wearing masks and when they are to do so, but you must always in public wear your mask. And also there is statutory instrument number 153 of 2020, which is the COVID-19 Prevention and Control Prohibition of Assembly Order 2020. And at section 2 it says, a person shall not host or attend A, social event, or B, tournament, sporting and contact sport that consists of more than 500 persons. So we need to ensure that we are able to comply with that at all times. Again, the minibus drivers, you need to ensure that you are wearing your mask and that the passengers that you're transporting are covering the mask. Traffic officers will be out there in full force to ensure that there is full adherence and compliance to this law. Passengers also, if you board a bus and you realize people are not wearing masks, you need to protect yourself. And not only that you're protecting yourself, you're protecting your family, you're protecting your community. We need to show love. We need to show that we are concerned about our country. Because one person can affect hundreds and thousands of people. I also urge those persons out there who know of the people who are coming through back door. You need to inform the police. And you need to do that because these persons, whereas they may seem as your loved ones and you may feel as a matter of love or because you care about them, you do not want to report it to the police. I think it is the reverse if you're not going to report it to the police. Because you are more or less destroying them, yourself and other people in your family. So, like was said earlier, I would prefer to see compliance as opposed to using the long arm of the law to discipline the indisciplined. I urge members of the public, we are all in this together. We want to work with you. We want to work together with you in ensuring that we prevent and control the spread of this virus. It is something we're seeing around the world, what is happening. We are lucky in St. Lucia not to have had a death. But that is not any sort of consolation that we should just act vitae and behave that we do not have COVID. It is real, and I think this particular case is a wake-up call for everyone. Any one of us, we may say that, okay, we're not traveling on the minibus. What about the person who travels on the minibus, who works at the office together with you, or would be at a restaurant together with you, or be at some other place with you? Let us be each other's keeper. Let us ensure that we protect this island of us that we call Helen of the West. It is for you, it is for me, it is for all of us. Thank you.
Thank you very much for that, Commissioner. Let's get into some specifics. We heard Prime Minister CMO indicate that as it stands now, we do not have sufficient or conclusive evidence to determine community spread. However, based on what has presented, there is that assumption that there is community spread. Take us through more clearly than you did earlier so that the public can have a full understanding of what is at stake. The individual, there still is question as to whether the individual presented himself at a facility whether he was called upon by the authorities, some way, somehow, he must have done a test and the test came back positive, and then he was reached out to, that sort of thing. I think it is important for people to understand the chronology of events, because as the Prime Minister indicated, there is the public belief that it is a hoax. So let us demystify the events for individuals.
Thank you very much. Good evening again. This case, number 29, I think this has been our highest risk case for community spread so far in all of the cases that we've been dealing with. Like we indicated, this gentleman, he went into one of our respiratory clinics on the 8th of October because he developed signs and symptoms of COVID-19. So he was seen, he was reviewed, and he was tested on the 8th. The sample was taken on the 8th, I think that's Thursday, and by Friday night, the results were presented. So we reported on this on Saturday morning, that it was a positive case. The risk is increased in this case for a number of reasons.
Pardon me, CMO, but was he allowed to go home after testing?
Yes, he was. Our protocols at the respiratory clinics is that everybody with signs and symptoms get tested. And what we request is that persons stay home until the results. We have built the lab capacity to allow us to get results within 24 hours. So if the sample was taken on the Thursday, by the Friday night, those results were made available to us, which we reported on Saturday morning. On receipt of the results, the patients and the necessary persons were informed, and he was transferred to the respiratory hospital for treatment and care. And from the very night, the interviews and the necessary started to try to get to our index case to reduce the possibility and to contain the spread of disease. So what we've done so far, a number of measures within the community in terms of trying to trace everyone who he may have been in contact with. Now, this case, unlike our other cases where we were able to connect the dots to see all of our possibilities to test, is quite difficult. This is an individual who was symptomatic with the respiratory symptoms of cough and sore throat, etc., and was working as a minibus driver. That is,
even as the symptoms were developing.
Even as the symptoms were developing. So if you notice in our information, in our request to the public, we ask that anyone who may have boarded the bus from a period of time up to Thursday, we've asked for them to report to specific clinics, which we extended the hours from Saturday into today to come in. And the numbers are still coming in for me, because from Saturday into Sunday, we saw quite a few people coming in with concerns. And we said, even if you're not sure, come in, get assessed, get tested. We're trying as much as possible to widen the net of the possibilities of persons coming through between Vieux Fort and Cashry. So we made available those extended clinics from Vieux Fort, Dennery, Leclerc as well, Wellness Center, to ensure that we can manage. We've also set up testing and assessments within the community as well to make it easier access for persons who may have been concerned or possible contacts of those cases.
One of the things people can go in, the question coming up is transporting people to these clinics. Is there responsibility for the ministry, for the authorities to provide special transportation in order to isolate individuals?
Well, what we did arrange transportation within the community to get to the outpost for testing. That did happen today. We did arrange for that. But then the general public, who most of which are asymptomatic, we ask that anyone who's concerned, if you think you may have been on the bus, and I just want to highlight the importance of the protocols. For the minibuses, the protocol indicated 10 persons. The protocols are actually made in anticipation of positive cases. Because if we have a positive case and the distance is kept and you have your face mask, and the possibility of transmission would be low. But as our officers on the ground, through their reviews, have been reporting, the compliance on the buses has been very poor. And for that reason, we anticipate a level of transmission on the buses. In terms of the numbers, We know the buses have been filled to capacity. We know that a lot of persons don't continue to wear the mask regularly on the bus. So there is a possibility for transmission of persons who may have been on the bus commuting from that. And also the distance also increases the risk. A bus is a closed
environment,
a closed space, and to be on that bus for that period of time with a symptomatic person, this is why we anticipate increases in cases moving forward.
So you're saying that wearing the mask is definitely a fail-safe. You can have protection.
You definitely.
Even if an individual
even if there's a positive.
Coughing.
Yes, if you have on the mask, both of you have on the mask, if someone is symptomatic, it greatly reduces the possibility of transmission. So if those protocols were held, we would feel a lot more comfortable in terms of the transmission. And also, given the nature of the contact from what we were understanding, we are not getting the level of cooperation that we need and that we anticipated. And for us, I know the commissioner is there, but for us at the ministry, our priority is public health and safety. Our priority is not prosecuting, or this is for the police to manage. For us, we want you to come in if you know you have a family member. We want to assess you, we want to treat you, we want to take care. We need to identify the index cases. We need to get the zero case, the first case. It will definitely improve the effectiveness of our contact tracing in terms of getting all of the contacts, ensuring that they are reviewed and they are tested. This case does have the capacity to cause us to get island-wide spread. So that is why, as indicated by the Prime Minister, at this phase more than ever, it is extremely important that we adhere to those infection prevention control measures, because we do not know who may have been on a bus and decided not to come into our clinic and spread. It could be the workplace, it could be a business place. So at this phase, it is really critical that each and every one of us take that level of personal responsibility in adhering to the protocols.
Okay. Where, in terms of being able to find the source of origin, we heard the Prime Minister and the Commissioner speak to the sort of illegal entry. Perhaps I should ask the Commissioner then, do we, in our sort of heightened phase, what I consider to be our heightened phase with COVID, we knew of instances where people were coming through the quote-unquote back door. Commissioner, how prevalent is this practice still, and how much of a grip does the police force have on it?
Well, it would appear that it is still happening. We have been patrolling, and we've been covering most of some of these illegal ports of entry. But St. Lucia being as porous as it is very difficult without the help of members of the public to be able to man all of our open spaces. However, if people are going to assist and people provide the information, it could make it better for us. And at the end of the day, people need to understand one thing. When the people have, if and when they have come in through the back door, it is better for them, and I think it is more beneficial to them and also to you and your family if you report it to the police, that at least we can take certain measures to bring them into the quarantine to be tested. Okay, and that can help prevent the spread. But we are trying our best, and like I said, it is an offense to enter any port that is not a legal port of entry, and we're going to enforce the laws as much as possible.
Okay, Prime Minister did indicate that this evening here is not to indicate a shutdown of the country, and he explained economically why we can't afford it. CMO, medically, can we afford not to have a lockdown, given that we assume that there is that community spread taking place?
Our initial measures, which we instituted when we did have early community spread earlier on in the outbreak, proved very effective in allowing us the time to do the contact tracing and to reduce the spread. And those measures are very effective. The national shutdown, the curfew, all of those measures have assisted in reducing the movement, because it's really the face-to-face, the gatherings, the large crowds, and in countries that have failed to put those measures in place, they continue to see the increases in cases of COVID-19. So these measures are very effective. However, the information that we have in terms of our results, we're not finished all of the results. We have not finished our assessment of the situation. I don't think we have enough information to make such a recommendation.
How would we know when?
We anticipate after a few days of testing, then we'll be able to give a better idea of the impact.
So are we looking at numbers in terms of testing? If we say we've tested 1,000 people, we looking what sample size are we looking at?
We're looking at about 500 to see what percentage, what positivity rate we get from at least 500. So maybe in the next few days we'll get a better idea of what the level of spread may be. But notwithstanding, our protocols are robust enough that if they are followed and if we get adherence to them, even with community spread, the need for a full shutdown would not be necessary. And I'm saying that, although when I say community spread, it all depends. Is it sporadic cases? Is it a huge community? It all depends on how the level of spread is. Such a decision would be made, such a recommendation would be made. But a huge part of us, because as we indicated earlier, we expect to be living with COVID-19 for 2 years. So the practicality of a continuous shutdown every time you're dealing with cases, I think as a country, we need to learn to manage the cases effectively and still carry out our function. So notwithstanding, it depends on what our results show, where the cases are, where they're located, how they are located, such a recommendation would be made. But our protocols, if adhered to, are robust enough to allow us to protect ourselves, reduce transmission, even having COVID-19 cases present, but at a manageable level. And as much as possible, we have a full list of indicators that we use to show, because it's extremely important that we not overwhelm our healthcare system. We have to ensure that the numbers that we are managing would not affect our testing capacity, our capacity to treat, our ICU capacity, the respiratory hospital beds, our present human resource within the country, the amount of PPE that we have procured. Because what we've noted in a lot of countries, what causes the deaths with COVID is when you're not able to manage the complications. Because remember, at least 5% develop complications. So we have to ensure that whatever numbers we manage in our healthcare system has the capacity to manage them effectively, to reduce the possibility of getting COVID-19 deaths as we see in all of the islands around us.
I'll follow up on that shortly, but let me just ask you regarding to schools. I know that parents, because you just perhaps can't keep your children safe enough. So yes. What is the recommendation for parents? Are we leaving it all up to the parents to decide, should I be sending my child to school come Monday?
Yes, like I indicated earlier, COVID-19 is not something that's going to disappear. So we need to remove, although I'm beginning to think that the fear and panic might be good, because when this happened, everybody was ready to put on their mask and do the right thing, when we've been saying that we have to maintain the protocols. But we really don't want fear and panic. We want responsible behavior. So the school protocols and the Ministry of Education has been very proactive in the measures that they put in place. So the school protocols are also organized in a way that will keep the children safe. We can't make a decision that 2 years we keep schools closed. We have to be able to manage and manage safely. It would mean, given this new risk that we are under, that our level of surveillance, both within the ministry and with every service, it means the Ministry of Education, just as every other business place, has to ensure that there's surveillance systems for diseases, that children don't come to school with respiratory illnesses, they seek care, and like I indicated, our clinics remain open, and all of that care is provided free of charge to the public. So we really want, especially now, anybody developing respiratory signs and symptoms to please go to your nearest respiratory clinic to get tested, because we are at a point where there may be cases out there that we may not know of.
Is there a provision for individuals who may feel, for one reason or another, they're not able to make it to the respiratory clinics?
Yes, they can
that they can be visited by?
Yes, they can be visited. They can also call in, and there's also the 311 hotline, which is still functional. That they can, if they have any concerns, they'll also be guided as to what's the next step based on the situation.
Okay, so we are thinking it through very comprehensively. You mentioned numbers earlier in terms of being able to manage the numbers so that we do not have the severity of complications. Someone online wanted to know, what does a flattened curve look like for us? How many cases can we manage before our system is overwhelmed?
Well, the capacity at our respiratory hospital is 85 beds, and bearing in mind that 5% of persons become critical for COVID-19, we need to look at those numbers as to how many persons that we will need for hospitalization. Our present policy is all COVID-19 cases remain in care at the respiratory hospital. If we were to develop community outbreak, that means we're dealing with another phase of management where we have increased active cases within the community. This protocol would change, where the hospital would only be responsible for cases that actually need severe hospital care. And to date, we've been quite fortunate that we've only had one patient becoming critical and recovering. Most of our cases have not been severe at all to need any level of serious hospital care. So these are some of the issues that we look at. We look at, because we did our reviews to see if we need increased quarantine capacity, if we need to increase the number of beds within the hospital, what is our PPE capacity at this point, because we would hate in the middle of an outbreak to run out, and what systems we have in place to ensure that within a few months we were able to restock our testing capacity as well. Because if you note, whenever we get cases, and a case of this magnitude where over a number of days we're trying to track persons who were on the bus, persons within the community, the lab has been working throughout the weekend to ensure we can keep up in time as well.
Okay. The numbers on the bus will remain at 10?
At 10.
At 10. So we're not changing the numbers for buses, except that you need to wear the mask, follow the complete guidance when it comes to the protocols. We released the license plate number. St. Lucians, don't look that up when you're into a bus to see. So how best can we do our own contact tracing? What then? Should we now decide on having perhaps a sort of manifest on the buses? Get a clipboard and have, as passengers come in, write their names and numbers?
Yeah, that's actually ideal. It would have been ideal if we had a full log of everyone who came on the bus within the week.
We spoke about that.
Yeah, that would have been ideal. It would have made contact tracing for everybody on the bus a breeze, that we just call up those persons and then we know we have everybody. But we don't have that information, so we're relying on the honesty and the responsibility of commuters to go into the respiratory clinic, protect yourself, protect your family, to get assessed and to get tested.
Yeah, and maybe now is the time that we can be more relaxed. Perhaps our phones come out at every turn, and maybe now we should be turning to our person next to us and clicking the photos just so that you can have an idea as to what's happening to you throughout the day. Just a quick suggestion. Yes, PM.
So if I can say, Liz, I think that it's very good to go through this discourse. And there are details that we're also forgetting here. So it's not just the passengers. He's a bus driver. Bus drivers stay at a station, particularly when you talk about Vieux Fort and Castries route. So they spend a tremendous amount of time. So all of a sudden that spreads to other places. So what does this mean? WHO and all of us have realized, and we can only make that statement now because we can't shoot ourselves in the foot and say, oh, we should have never shut down previously. In the early days, we had no idea to the detail how to control COVID. It was still an unknown entity. here we are 6 months later, and we know that there are certain things that work. Wearing your face mask, hand sanitization, social distancing, act like I have it, and act like everybody else has it, exactly what the commissioner says. So tonight is an alarm bell. It's sadly a 3-bell alarm bell. This is a major fire. And what this means is that we have to act very quickly to say we're going to have a community outbreak. The solution is everybody has to lock down and wear their mask and get back into the discipline of doing the things that we're going to do. How does that help? That will immediately start stopping the spread. And it means it allows us to start identifying, because those persons that are going to be affected and are going to have symptoms are going to come in and are going to be tested at some point. But ideally, the contact tracing is to try to get them to come in even earlier so we can put them into isolation, because they may be tested positive but at a low period. It means that we would have caught them at the right time. So right now, it's about containment, containment, containment. So even if we get some test results, and let's say we have 20 people that are going to test positive, the recipe is the same. Can't shut down the country. WHO now and everybody else has agreed, shutting down the country is not the solution to the problem. You can coexist with COVID, exactly what the CMO has indicated, but you have to put the right protocols in place. So this is a 3-star or 3-level bell to say we have a crisis on our hands, and as of tonight, if not first thing tomorrow morning, we have to go into full battle mode. And that is everybody, please wear your face mask. Try your best to sanitize your hands or wash your hands multiple times during the day. Practice social distancing. Commissioner said, let's become each other's brother's keeper. Somebody asks you to put a mask on, do not give them attitude. Do not start telling them there's no COVID in St. Lucia, you're not putting your face mask on. Put your mask on. Let's stand up to our responsibility. And I'm here as your Prime Minister to tell you that the consequences of not doing it are the following. If in fact we end up having many more cases, reality is that we're going to be taken off of the bubble that we are enjoying currently with some other countries. So it means that persons are going to be less incentivized or motivated to come to St. Lucia. Because who's going to come to St. Lucia if in fact I have to be quarantined for 2 weeks afterwards? If in fact there's nobody coming to St. Lucia, it means the hotels who are now rehiring are going to themselves have to shut down. Not because the country is shutting them down, they're going to shut down because there is no business. And if that starts happening, and now persons are going to be looking back to the state to find resources to be able to help them, that's going to be a difficult task. I mean, it's one that we would have to face, and we're going to have to find a resolution to it, but it's going to be draconian because the numbers don't lie. Now, I don't want to start talking about what ifs and look at all those different scenarios. I'm here tonight to appeal to everybody in St. Lucia. Let us deal with the reality. We have our worst fear. Someone has been affected, we believe, which started from somebody coming in through the back door. That person has waited a fair amount of time and could have affected other people. The person who came in, who affected this person, may be affecting other people. That's the reality. And it would take a miracle that there is not going to be more cases. But regardless of how many more cases we have, the remedy is the same. Now we have to pray that we're catching it early enough, and that's why starting tomorrow morning is so important. To try to minimize the spread and contain it right now. But we need your help. And that's why, as your Prime Minister, it's not about wanting to have a heavy hand. It's about protecting both lives and protecting our economy. And that's why I'm appealing to the Commissioner and to all of the police officers. We must enforce. I'm appealing to all the business houses. I'm appealing to the general public. Take it on yourselves. Let us deal with this crisis. Everybody. And stop with this thing that there is no COVID in St. Lucia. We were blessed that we did not have COVID in the midst of St. Lucia, but the threat of us getting it was always there. And that's why this argument as to whether we should have a COVID bill, we can speak about the semantics of it, as to whether it should be a state of emergency, whether it should be this, but the protocols that were developed over the last 6 months, we know that they work. Information we get from WHO and then eventually to CARFA, we know that that's good information. We know that countries who have peaked have only been able to curtail it by enforcing the social protocols that we're speaking about. The COVID Act is simply to give it authority to make sure that we can do it from a legal basis. So I'm appealing to all of us. We are under threat. The war has intensified. It's real. It's back in our backyard. The only way to protect yourself, to protect your family, to protect your neighbors, and to protect everything else, please, please adhere to these rules. Tomorrow, take it to the nth degree. The quicker that we can do that, 100% of us, I assure you that the quicker we'll be able to reverse this trend. Some of the damage may be done, but as quickly as we can now reverse it and be able to eliminate the community spread like we've done before, bring us back into the safe reign and an acceptable level, we can move forward. We have the respiratory center. We have medicine on hand. We're better equipped with PPEs than we've ever been before. We are ready, but we need you to do your part in this situation. It is, I am being honest with all St. Lucians, not only a battle for the health of our country, it is also a severe battle, a real battle on the economics of our country. We're attending the meetings, and there's been tremendous amount of help, but yesterday, individuals from the World Bank and the IMF indicated no debt forgiveness. You need to adjust and rationalize your budgets. So if we can't grow our economy, or at least recover to where we were before, there's no way that we're going to be able to justify continuing to spend the money that we have been spending on anything. So I'm appealing to all St. Lucians. It's for all of us. It's your family, for all of us, that we must work together to solve this problem.
You preempted me there, PM, because I was going to ask you about that. That has been the talk on the international, so certainly for the Caribbean, because Prime Minister Motley has really been on a campaign rallying for debt forgiveness for the Caribbean, and to have had that come out of the World Bank is certainly a devastating blow, and to even have the explanation that Caribbean countries are rich. And that, because that was in the explanation. So it certainly speaks to the vulnerability of the Caribbean beyond our own health limitations.
Well, as leaders, we have been arguing for several years now, particularly after climate change, that to use per capita GDP, to use debt per GDP is unreasonable. Because in average, it's fine. But in absolute terms, meaning if you multiply that ratio by the population, it's an insignificant amount of money. And we've been arguing to use what we call a vulnerability index. And sadly, that vulnerability index was established in 1989 by the Commonwealth Secretariat. So this was really just, I mean, we're certainly not going to take this lying down, but it just tells you in the midst of all of these problems that a statement like that can come out, that we can't take anything for granted. And you would think that the evidence speaks for itself, but to change that global architecture, economic architecture, is difficult, really difficult.
So how do we contain costs? Because we've been told to do that. We've been advised to contain costs during COVID-19, yet we need to borrow in order for us to be able to undertake those programs. Contact tracing, I'm certain it takes up a large amount of the budget. So how do we contain costs and for us to take care of all of our other needs in this COVID period?
Well, it's very conflicting. You know, the managing director, Kristalina, came out early and said government should spend as much as they possibly can and keep the receipts. Then we're told that invest in capital investment projects, because getting roads going and getting other construction going helps now augment the social stabilization program. So instead of just literally handing persons income support, it's actually putting them back to work. And so at the end of the day, there's actually some physical investment into the country as well. So it's a win-win situation. And you have the real situation that globally the world has remained shut down. So most of the small island developing states of the world are tourism dependent. And that's why at the meetings that we've been having, that I'm saying, look, it's one thing to deal with the global economic architecture, but in the meanwhile, what we can do is try to regain the global confidence in traveling. And the way to do that is by getting persons to be pre-tested. Yeah? So IATA, American, United, all over the world, people are now embracing that idea, and I'm very proud of that. That idea came from St. Lucia, has been embraced by our colleagues in the Caribbean, and we've been out there agitating to make that happen. But guess what? There's still a responsibility on our part. There's still a responsible behavior that's required on our part. This attitude that, oh, COVID doesn't exist in St. Lucia is unrealistic. And therefore, we must stay away from it. Until COVID is solved globally, we have COVID. We have a reprieve, and that reprieve was gotten because we've been putting in good practices. And that's why I kept on saying, all those persons who are out there saying that we shouldn't do this and shouldn't do that, the question becomes, how do you argue with success? Why would we want to go away from that? And I can certainly say, I know repeatedly as Prime Minister, the CMO, the police have said that the threat that we have is the backdoor entrance. Persons who are coming in illegally because they're not being tested, and by the nature of coming in illegally, are hiding. And the problem is we wouldn't know, whereas when persons come in the right way, we're properly testing them. And I understood, it was a big decision in terms of having to go away from allowing persons to come in and that we would pay for the quarantine. I know that there will probably be even more persons coming from Martinique, as an example, who would be tempted to come in illegally now because they don't want to go through the cost. But that was the sad reality, is that we don't have the money. I want to do it. Who would not reasonably want to continue it?
But you can argue, PM, that we were offering it for free.
We were.
And people were still using the illegal ports coming in because they didn't want to now confine themselves to the 14 days.
The commissioner's here. The 4 Marine police boats we had that are from April have had to go out literally 24 hours a day, 7 days a week. So the man hour to man those things, the burning up of engines time. Now I'm having to get 12 new engines. Cars, because cars are now going out on a regular basis. So by the nature of what we're having to do, government is working in overtime. The CMO's office, the Ministry of Finance, Customs, security in general, education officers. People said, oh, they're not going to school. They've been putting together the curriculums to be able to make what we're having. And I mean, I meet some of those teachers. This is fish out of water. Not being able to see the student on a regular basis. Not being able to interact to see whether, in fact, the child is learning. Kids who are coming into secondary school for the first time, who don't know their way around school, are going to school every other day. These are all difficult things which require more time than they had before, than less. And so we're burning through a lot of manpower, a lot of cash to be able to reserve this. And that's just what the reality is. I'm not complaining because that's what we've been confronted with. But I have to say to the public of St. Lucia, the solutions that we put in place for health, textbook. How do we know? The results are there to speak for themselves. The solutions we've been putting in for the economic recovery, textbook. The evidence is there to speak of. Flights are coming in, we're growing, hotels are reopening, businesses around, tax revenue is starting to pick back up. All of that will come to naught if we're not disciplined. That's the word, disciplined. And to understand that COVID is bigger than all of us. And that we know, that's the sad part, we know wearing a face mask, hand sanitization, social distancing, treating other people as if they have, and treating yourself as if you have, that works. Okay. That's not a huge sacrifice to make for the benefits that we can get. And I'm really praying that it's not going to take for us to lose those liberties, for us to have learned our lesson.
I just want to ask you very quickly, PM, because you indicated on the quarantine and the fees. Now that we're facing this situation, is it likely that we may see a revision in the fee structure in order to allow individuals to feel that they can perhaps fully comply?
Well, the state has already done it. Students that are coming back, persons who went away for health needs, there's mechanisms to help those who cannot help themselves.
Okay.
But the fact is the $95 is not a revenue generating amount of money. Those are real costs that are associated to it. So tough choices. I can only say to everybody in St. Lucia that there isn't enough money to go around.
However, you've made some specific provisions for, as you indicated, students and other
We've made
vulnerable
provisions.
groups.
We would not do it unless it was absolutely necessary.
And a case-by-case basis?
Case-by-case basis. I mean, look, we're still trying to operate OKEU, unbudgeted, because we were supposed to have had healthcare insurance introduced. Mm-hmm. The reality is healthcare insurance is an insurance, which means persons who are employed would make a contribution. Businesses would make a contribution. Can you imagine the pushback that we're going to get now that we want to put healthcare insurance? But where is the money going to come from now to cover the extra cost of OKEU? Okay. And also now putting in a proper organizational structure for it to run, because you can't just go from what Victoria was to OKEU. We're doing now the same thing where we have Victoria. Victoria was supposed to be shut down. We're having to run Victoria.
Yes, as the respiratory hospital.
Right. And then you have all the other respiratory centers. So I'm just saying this is that you had a situation pre-COVID where there was budget deficits. Now you're talking about half the money that was coming in before in tax revenue and increased expenses. And so we're making it happen. And once you can now start seeing that you're on a trend backwards, because the World Bank and the IMF are going to want to see a plan as to how you're going to manage your budget, your deficit, and how do you get back to fiscal responsibility. And these are the things that we're all trying to balance as small island developing states. St. Lucia is not the only one. We're all in the same boat. So even a Trinidad may not be tourism oriented, but when the price of fuel has been down to what it is, it's impacted their own revenue. Luckily for them, they had a significant reserve, a sovereign account where they had, I think it's $8 billion US. The rest of us have not had that. We've been running deficits for years. In fact, we owe more money than we have sovereign facilities. And the IFIs, the international financial institutions, they themselves must be strained by the demands that are being put on them. So I'm just saying, for me, to my fellow St. Lucians, my philosophy in life is to try to do the things for myself that we can do. Don't sit here and wait for the outside world to come and help us. So a significant way that we can reduce our cost is by following these basic protocols and taking proactive measures. If we have to wait for this fallout, where our respiratory hospitals are going to be full, and that to the extent that tourists are not going to want to come here, and that means that we have no potential revenue coming in, and the state is going to have to find resources, which we would have to find, to help cushion the blow for the people of this country in terms of making sure that they're fed, making sure that they're still getting access to healthcare and security. There would have to be fundamental changes on how we do business on a daily basis.
Thank you so much, PM. Personal vehicles and carrying capacity, Are we doing any augmentations there? Are we holding? Are we at that point yet where we need to decide to tell? Okay, so, and once again, we are keeping the 10 passenger capacity for the minibuses. And so once the CMO has indicated 10 people on the bus, wear your mask and the other protocols, and everyone should be safe enough. And no, they're not changing for personal vehicles. You can go ahead and, of course, wear your mask if you don't have family members on board with you. I do want to spend our next few minutes on the dengue fever. We know that has been, it is creeping up on us, and it's certainly proven to be more challenging than we initially thought. We know we had said that there was the outbreak, but now we've had 2 deaths, if I'm not mistaken, and the numbers keep climbing. So CMO, with COVID, now dengue, there is that fear and panic as well where dengue is concerned. Is the ministry doubling up its efforts now that we're seeing that escalation?
Yes, we have been, and as most persons know, dengue fever is endemic to St. Lucia, so we normally get increases during the rainy season, that is June to November. But this year, as we note in quite a few of the other islands in the region, we've noticed a sharp increase in cases within a very short period of time. We've also noted that we have cases island-wide, so it's not focused to one community. It's all of the districts around the island are affected by dengue. And we've also noted that in the age group less than 14, we have a lot of young adults and children affected at this time. Our circulating strains, that is the serotypes, are 2 and 3. And we've traditionally had 1 and 2. So it means this year we have a susceptible population, because if you've had dengue fever before and now get a second strain, you're at greater risk of developing the complications to dengue fever, which we are noting and we are seeing based on the admissions that we have at the hospital. It is really imperative. At the ministry, we've been increasing our entomological surveillance. Also, we've been doing the fogging, but as you could imagine, because we have so many communities that are affected all at the same time, it makes it very difficult for us to keep up in terms of the fogging. So we've started with the communities with the highest mosquito indices at this time. However, we really appeal to the public in terms of ensuring that you reduce the breeding grounds for the Aedes aegypti mosquito. So we're asking for everyone to do a review in your surroundings, go around your home to look for the areas that the mosquito can be breeding. It's a domestic mosquito, so it tends to breed in clear, clean water. So your buckets, your drums, your flower pots, sometimes the guttering, anywhere where you have a collection of water could pose a high risk for mosquito breeding and increased mosquitoes. So this is really critical, and we also urge the public that if you develop dengue fever and you're not improving, to go to one of the wellness centers closest to you to get care. If you have a child that's not improving, one of the issues with dengue fever, it causes your clotting factors, your platelets to go low. And then you can end up getting bleeding at different points. So it's really important that if you're noting that you get the dengue fever, you're not getting better over time, that you seek medical care in a timely manner so we can do the necessary tests to ensure that you are improved. We are really hoping that we can reduce the numbers, although we know the numbers that we get at the ministry is just the tip of the iceberg, since a lot of persons don't go in for care if it's not severe.
You know, we into our bush medicine. We love our traditional medicine there. And you speak about, people staying home and then they take the bush medicine and they say, well, in 3 days it will be better. The 3 days will come and pass and then they'll take more. And so the advice on when is the time to say, let me stop and go seek medical attention?
If you're getting the signs and symptoms of dengue fever, that it gives a very high fever, so you have to take medication around the clock. The pain at the back of the eyes, you also get. You get joint pain, body pain, generalized weakness, loss of appetite as well comes with it. The best thing to do is to take paracetamol, not ibuprofen, not Voltaren, not naproxen. Those make it worse. So you need to take paracetamol, Panadol.
Okay, just tell us why it makes it worse.
Because those are anti-inflammatory drugs, so the risk of causing bleeding, since one of the complications of dengue fever, when your platelets go low, then your capacity to bleed out is a lot higher. So none of those, none of the ibuprofen, none of the Voltaren, none of the naproxen, you don't take those when you have it. Paracetamol every 4 hours, and you must increase your fluids. It is very easy because of the high fever to dehydrate with dengue fever. So you have to keep your fluid intake high when you have the dengue fever.
So nothing like, well, I took the paracetamol and I still have the headache, it's not working.
No,
I'll go for something stronger.
No, every 4 hours you take your paracetamol, you drink a lot of fluid. Now, if you notice you're very weak, you're getting vomiting, the pain is worse, or you notice bleeding to your gums, all of those are signs and symptoms that you're beginning to complicate. So you need to seek medical care to get the necessary blood tests done in a very timely manner.
Okay. Are we overwhelmed at OKEU right now with our bed space? I know that we had numbers going in, people with dengue requiring hospitalization. How are we managing on that end?
Yes, well, with the increase in cases of dengue fever that need hospitalization, as usual, OKEU is always a challenge for hospital space. So we have been having issues in terms of bed space at the hospital.
So it wouldn't be unusual if you go in, then they give you a test, perhaps they observe you for a few hours and then send you home with some medication and direction.
Right. It depends on the severity of the disease. But we ask the public, if you're having mild disease, don't go to the hospital. We have a series of wellness centers which are accessible within the communities. Go to your wellness center to get reviewed. We have the polyclinic that's open every day till midnight, Saturday and Sunday and holidays. Dennery Hospital is there, Suffolk Hospital. Try to access care at those points so that it's only if you need hospital care, you'll be referred accordingly. Seek care at your community center instead of going to the hospital where they may be very busy dealing with more severe cases, more urgent cases, and then your wait time is increased. So access care at the community centers before.
Okay. PM, finding the resources, because dengue, it's another chronic situation that we have to manage as well. We heard the CMO, she spoke about what needs to be done on that medical front, but we know that the resources are needed as well.
So again, we're trying to spread the resources as much as possible. And I certainly would like to dismiss this idea that, oh, well, don't build a road or stop the airport or don't do this. These monies are completely unrelated. The monies that we are accessing to do roads or to do the airport are monies that we're borrowing in which there is a revenue stream dedicated to it. So again, the airport tax as well as the gas tax that we've been collecting have been going into a pot to be able to pay for those loans. So it's not to say I can just stop the road project and take the money from the road project and apply it to this other situation. When we're having to now find additional resources for the Ministry of Health, additional resources for my police officers, additional resources for the Ministry of Education, additional resources for community centers and the community, and also additional resources to help persons during this very difficult economic time. It's tough, and we're juggling and prioritizing them as best as we possibly can. I'm certainly not the one making those decisions by myself, but I certainly help oversee those very difficult decisions that we have to be able to make. Dengue is real. I mean, over in Martinique, there's 11,000 cases. I certainly know firsthand because my father and other friends who've had it. And you talk about home recipes, you know, papaya, tea. And you know, the problem with that, nobody makes the tea the same strength every single time. And therefore, while it may seem like it's going to work, if you take too much papaya tea at the wrong strength, it's going to have other implications with your other organs. But I know that people are resorting to anything to get rid of the pain that they're in. So I want to say to you that your government is working cognizant of these issues, making all the necessary resources we possibly can. I want to thank the doctors, the nurses, the teachers, all of the civil servants who've understood and recognized what we're going through and doing the best that they can to manage in these very difficult times. I also want to thank the businesses that have remained open, the hoteliers that are willing to open up, and all that we've been doing collectively to restart our economy so we can start taking care of ourselves. And the last thing I just really want to leave on, Lucia, is again, just remind everybody, we can control our own destiny. How bad this situation is going to be is contingent on us. Tourists have a choice not to come to St. Lucia. St. Lucia nationals have a choice of not to return home. But the rest of us don't have a choice as to where we can want to go. So I think for our own sake, nobody else's, let's take care of ourselves, and in doing that, we're significantly going to help ourselves economically as well, because the economic situation is very difficult. And I just want to again thank everybody for their support.
Thank you so much for that. And CMO, I'm going to give you that 45 seconds so just to reiterate for St. Lucians the lines that they can call, and of course to implore their cooperation.
Yes, well, within that 45 seconds, I definitely want to recognize my teams on the ground, our contact tracers, the lab, central procurement, the physicians. It has been a very long weekend. They've been on the ground from early Saturday. We've been at it trying to see how we manage this new case. This case, like I said, it is presenting a new risk for us. So we absolutely need the cooperation of the public. First of all, the cooperation of all in terms of assisting us in identifying the persons who brought this in. For us, we want to assess, we want to treat, we want to take care. This is our priority at the Ministry of Health. So come in, let us know, we'll manage. We need to do that. We need to get the cases. So we want greater cooperation on the ground so that we can more effectively contain COVID-19. We're also asking that persons adhere to the infection prevention control protocols, use of masks. You have respiratory signs and symptoms, do not go in public, do not go to work. You either call 311, you go to one of the respiratory clinics, you call in, you get care. And we also want for persons to look out for each other. If you know it is to the benefit to provide support, take them to the wellness center. Even if you're afraid to go to the police, come to the wellness center. Let us get you tested, let us assess you. As much as possible, we want to reduce the impact of this case because we know the possibility of spread from this instance is quite high.
Commissioner, on your end, a final appeal. We know that, as you say, Monday morning, definitely compliance with face mask. No one shall be exempt.
Okay, what I need to say to people is that compliance, enforcement is not about trying to be difficult or coming down hard on people. It's about ensuring that there is respect for the law, there is cooperation and compliance. Also, I want to thank my officers again, and I want to say to them, I understand that in some cases, the conditions may not be the best, the conditions that we work under. But let us continue to do our best. Let us continue to show St. Lucia and the world that we can be the best police force out there. And in due course, I mean, you will get what is due to you. I urge of you to do your best and continue to work hard.
Thank you so much there to the Police Commissioner, Severin, Moncherry, to Prime Minister, Honorable Alan Chastanet, and the Chief Medical Officer, Dr. Sharon Belmar-George. Just to reiterate for you that there's been no shutdown that has been announced of the country. This update really is to officially tell you that the health authorities are doing contact tracing in the suspected community spread. And by Monday, throughout Monday, we'll be getting another update from the CMO, which will give us some more conclusive evidence with regard to that. On behalf of the entire team here at the National Television Network, the GIS, I'm Melissa Joseph, saying goodbye.
Panic is not the answer. We can win this. get you soap and water.
We must protect each other if we are to beat this corona.
Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging are up. No, no.
Advice is you the please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. St. Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.